Hello.
Hello, let me close the curtain behind you. My name is Kristina. I'm going to be your nurse today. How are you doing?
I'm doing just peachy.
All right, can you tell me your name and date of birth?
My name is Dawn Stutler, and my date of birth is 8/28/82.
Okay, I'm just going to check your name bracelet, and that's correct. I see that you do not have an allergy band on, so you don't have any allergies?
Nope.
All right, do you know what the date is today?
July 12th, 2019.
Awesome. Do you know who the president is?
Donald Trump.
And do you know where you're at?
State Fair Lab.
Awesome. What brings you in here today?
Checkoffs.
Okay, Dawn, may I ask how tall you are?
I'm 5'4".
Okay, 5'4". Your body alignment on the bed is proper. You're a little obese, but I was reading in your notes that you're on a diet right now.
Yes, ma'am.
Awesome. How much weight have you lost to date?
40 pounds.
That's great, Dawn. Keep up the good work. Whatever you're doing is working. Your posture seems to be good. Like I said, you're aligned well. You don't seem to be slouching off to one side. Today what I'm going to do is I'm going to do a head-to-toe assessment. Have you ever had a head-to-toe assessment?
Yes.
Okay, so basically you know kind of what to expect, but I'm going to start from the top of your head and go all the way down to the bottoms of your feet and the tip of your toes, checking all the body systems between there to make sure everything seems to be working as it should and that I don't hear any abnormals or feel any abnormals, okay?
Okay.
So I'm going to go ahead and sanitize my hand, and then put some gloves on and we're going to get started, okay?
Okay.
Sometimes during this assessment, if it's okay with you, I'll have to listen underneath your shirt where I listen to your lung sounds and your heart sounds. So just wanted to let you know ahead of time. I'll also let you know right before.
Okay.
You feeling anxious at all today?
No.
You don't seem anxious. You seem very relaxed, answering all my questions appropriately, which is wonderful. I'm going to go ahead and help you to the side of the bed so that I can check your skull and your hair, okay?
Okay.
Is that comfortable?
Yes.
Probably a little better now that the bed's flat and not bumped up.
Yeah.
All right, what I'm going to do first is I'm going to look at your hair, and what I'm looking for is that it's well kept, that there is no indications of lice or other infestations, and that there's normal hair growth. Also, I'm going to palpate your skull to make sure there's no bumps or masses or skin breakdown, okay?
Okay.
Your hair seems to be well kept. It's not too dry, not oily, very clean. Looks good. Looks good. Just going to check the back nape of your neck. Looks good as well. Okay. Your head, like I said, is symmetrical. I don't see any breakdown at all. Hair is dry. Looks great. Now we're going to go to your skull and your face. Your face temperature feels warm. It is not overly oily or dried out. I don't see any bruises or bumps or any sores. It is symmetrical. Your nose and mouth are medial to the midline of your face. Your eyes are symmetrically spaced, both even, and they line up to your ears just fine. What I'm going to do is take a closer look at your eyes. Is that okay?
Okay.
Do you have any vision issues?
No.
Okay. What I want you to do is focus on something in the wall over here, and I'm just going to come up from the side and watch your pupils dilate. This will show me that they react to light. Right now your pupils are about 3 millimeters. So here we go. It's a bright light. Okay, they go back down to about a 1. Great. Okay, now what I'm going to do is test your ocular movements, okay? So I want you to just look at my pen light and then follow it as I move it, but only moving your eyes, not your head, okay? Here we go. Great job, Dawn. Doing okay? Okay, now follow it. It's going to go closer to your nose and then back out. Still doing good? Okay, I'm looking at your sclera. Your sclera is white. Eyes are a light brown color. You're going to film me just moving your lower lid. Your lids are great. I see that your conjunctiva is pink. I don't see any lesions or drainage, which is wonderful. Your movements are awesome. I'm going to check your ears. They line up with your eyes. Can you tell me if you have any soreness? Okay, they're very elastic, warm, no sore spots. I'm going to check for any drainage with my light. Don't see any drainage or any sores. I'm going to check this ear. Dawn, do you have any ear pain on the inside of your ears?
No.
Okay, that's wonderful. Now, I'm just going to do a slight hearing test on you, okay? So I'm going to occlude this ear, and you tell me if you hear anything.
Yep.
Okay. What about now?
Yep.
Perfect. Okay. And now I'm going to palpate your nose and your sinuses. Feel any pain when I apply pressure?
No.
How about right here?
No.
Okay, now I'm just going to palpate your nose. Feel good? Okay, so I'm going to inspect the inside of your nose. What I'm looking for is any deviations, which I don't see any deviation. There's no redness. The membrane is nice and pink. I don't see any drainage or lesions and deviations. Can you go ahead and occlude one side? Take a breath in and out. Awesome. Go ahead and do that on the other side. Fantastic. Now, Dawn, while you're sitting there, can you go ahead and smile for me? Okay, awesome. How about frown? How about stick out your tongue? All right. Now, that just kind of checks to make sure your movements on your face are symmetrical. I don't see any drooping of one side of your lip. Your eyes are both even, no drooping there either. So now I see that your lips are a nice pink, moist color, no bluing or graying, which is wonderful, means you have good oxygen supply as well. So go ahead and open your mouth. I'm going to peek in there. Don't see any lesions. Say ah. The uvula is hanging midline in the back of the throat. Tonsils are not swollen, no exudate. Can you lift up your tongue? Awesome, no masses. Teeth look good. How's that feel? Good? Okay. I'm going to raise you up slightly, okay? Donna, how old are you? All right. You don't feel dizzy, right? Being up this high, you feel good and steady? Okay. So now what I'm going to do is palpate your lymph nodes. I'm going to start at the back of your neck. Moving forward. And then I'm going to go down here. No soreness? Okay, Dawn, can you look up a little bit? Now, I'm going to look at your trachea. Your trachea is midline to the neck. I don't see any deviation to one side of the neck. Just going to palpate. Let me know if you feel any tenderness. Okay. Does that feel good? Okay, wonderful. You can go ahead and put your neck down. We're going to do some movements, and then I'm going to take a listen, okay? Can you put your chin to your chest? Awesome. What about raise your head one more time? Okay, can you look to your right? Your left? Okay. What about shrug your shoulders? Perfect. Now, Dawn, what I'm going to do is have you look up slightly, take a breath in, and I'm going to listen to your carotid arteries for a bruit. Okay? So tell me when you're ready. Go ahead and hold that breath. Okay. Sounds great. I didn't hear any bruit, which is wonderful. All right, Dawn, now I'm going to listen to your lungs. I'm going to listen at the apex, and I'm going to put my stethoscope underneath your shirt a little bit, okay? Is that all right? Okay, at one point I might need to go between your breasts And then once you lay down, I'm going to listen to that apical pulse for a minute. Go ahead and take a deep breath. Wonderful. Okay, you sound good this way so far. Now we're going to check your arm to see your range of motion, okay? I'm going to take your hand up to your shoulder and check for any crepitus in your elbow, and that just means any cracking or, sounds that maybe shouldn't be there. How does that feel?
Fancy.
Okay. Go ahead and move your wrist for me. Fantastic. You see that your arms are both warm. The hair is evenly distributed. It's good refill. Also that your nails are kept well, clean, and cut. Cap refill is about less than 3 seconds. No crepitus? Any pain? No. Go ahead and move that wrist for me. Perfect. Now go ahead and relax. I'm going to listen to your pulses. Listen, I'm going to feel for your pulses. Let's say about a +2, and they are equal. I'm going to listen to your brachial pulses. +2 as well. Okay. Dawn, can you feel me touching your arm? Doesn't feel funny. You actually, okay. That's wonderful. All right, Dawn, now I'm going to go behind you and listen to your lung sounds and check out your back. Do you feel safe at the end of bed like that?
Yep.
Okay, perfect. All right, Dawn, I'm going to lift up your shirt, okay? Don't see any skin breakdown, no redness, no rashes. All looks good. I'm going to palpate your spine to make sure there's no masses that I can feel or misalignments. You tell me if you feel any sore spots, okay?
Okay.
Any sore spots?
No.
Okay. Now I'm going to check in the area of your kidneys. Will I palpate any pain?
Nope.
Okay, what about when I percuss?
Nope.
How about now?
Nope.
Okay, awesome. Now I'm going to listen to those lungs. Go ahead and take a deep breath. Wonderful. Wonderful. All right. Lung sounds sound great. I don't hear any abnormal sound or extra sounds. They were really clear. I didn't hear no wheezing. Now I'm going to help you. I'm going to do a couple more exercises with your hands. Can you squeeze my hand?
Yep.
Okay. Can you put your arms out?
Okay.
Can you rotate those shoulders?
Yep.
How about bring them forward and raise?
Yep.
Any pain?
Nope.
Okay. So now let's assist you back into the bed to lay flat. Let's try these first. Can you push against my legs on my hands?
Yep.
What about pull?
Yep.
Okay, awesome. Now we can lay down. All right. Is that comfortable? I'm actually going to come on this side. I'm going to lift up your shirt, and I'm going to listen to your heart sounds again with my bell of my stethoscope. I'm going to count your apical pulse for a full minute. So we'll be there for a little while. Don't think anything's wrong. I just need to count that pulse, okay?
Okay.
All right, Dawn, 78 was your pulse rate. I also got a respiration rate of 17. When I have your shirt up still, when I was counting, I was watching that you have a good rise and fall with each inhalation and exhalation, which is wonderful. I see that your ribs are both equally spaced. You don't seem to have what we call a barrel chest. So now what I'm going to do is take a listen to your stomach. Do you have any history of urinary retention? Nope. So when you urinate, you feel like you don't have to urinate right after you stop that strain? Nope. Okay. So I'm just going to take a listen to your bowel sounds. All right, Dawn, now I'm going to listen to the other side and listen for some. Making sure I don't hear any arterial noises by your aorta. Right, and I'm going to palpate your stomach. If you feel any areas that are tender or hurting, just let me know and I'll stop, okay? I also know that your stomach is warm. You don't see any bruising or any sores or rashes, which is wonderful. It's warm to the temperature, not clammy or not sweaty at all. Any soreness? None today? Nope. I'm gonna raise you up a little bit higher. Okay. Now we're going to move to the lower extremities. I'm going to raise your pant leg a little bit, okay? Just want to have a good look. Okay. Right now, as I'm looking at your legs, I can see that they are warm to the touch, not cold. Excuse me, the hair is evenly growing on both surfaces of the leg. Do you have any tenderness while I'm touching your legs?
No.
They're warm, not clammy. Cap refill on these toes are less than 3. I'm going to fill for some popliteal pulses. Okay, Dawn, those are equal. I'd say a +2, so they match so far with your upper extremities, which is great. There's a couple more pulses. These ones I'm going to test are your tibial pulses. Okay. And those 2 feel great. They are regular and equal. And a 2 +2. These are your pedal pulses. Feels good, and as well, they are a +2 and they are regular, which means you have great circulation from all over your body. Your circulation is wonderful. So what we're going to do now is look at the bottom of your feet. Feet are clean, no issues, no sores. Dawn, can you pull my hands up to you? Push against. Awesome. Double check the bottom of this foot. Clean, no sores. Can you rotate your ankles? How does that feel?
Fine.
Okay. And no soreness, right?
Nope.
Okay, what about,
I can feel that.
okay. Now I'm going to put these pant legs down. Now we're going to do range of motion in this lower extremity. So what I'm going to do is put one hand underneath the back of your foot, another one on the back of your knee. I'm going to put your leg up. We're going to bend at the hips, and then also drop your leg out a little bit and then back down, okay? Tell me if it hurts. What I'm feeling for is any crepitus in those joints, and also looking for any pain that you may have. Okay, here we go. Doing good?
Yep.
Great. Let's just check this knee a little bit. Do the same with this side. Okay, here we go. Ready?
Mm-hmm.
Okay, great. Are you feeling comfortable?
Yep.
Still look like you're doing good. I haven't worn you out with all these exercises. I'm going to lower your bed a little bit. Okay, Dawn. You put your non-slip socks on. There they are. Going to help you to the side of the bed. All right, now what I'm going to do is just have you stand up once you feel like you've gotten your stability back, and just take a few steps forward and then a few steps back to me, okay? What I'm looking for is that your gait is steady. Your posture is still good after we've done all these tests and up and down and laid you flat and moved you up, so that's wonderful. I'm ready when you are. All right, Dawn, wonderful. I don't see any swaying. Your knees are strong. Feet and knees are both facing me, which is how they should be. Go ahead and have a seat. How are you feeling? Anything I can get for you?
Drink of water.
A drink of water. All right, I'll go grab that water and I'll be right back, okay?
Alright.